Dr. James Boone, medical director here at the Hacienda Treatment Center. I'm an internal medicine doc and an addiction medicine physician, so have sort of special interest in medical complications along with the psychological things that go along with drugs of addiction. I want to talk a little bit about the inhalant family of medicines. It's a pretty broad category, and basically there's 4 different classes, and I'm mainly going to focus about the one that we see most commonly over the past 10 or 15 years. But basically they have to do with a group of drugs or chemicals. The solvents would be one of those, and those are chemicals that typically are in liquid form that vaporize just at room temperature. So when you think about things that you can smell, so for example, gasoline fumes or smelling from a felt tip marker or paint thinner, all of those solvents have potential for abuse. Those drugs can cause a euphoria, this sense of this feel good. They can have some effect of increasing in energy levels or decrease in pain, decrease in sensation, whether those sensations from a numbing effect that you want to numb a sensation that's uncomfortable. But unfortunately, those drugs also have incredible potential for damage. All of these drugs that I'm going to talk about, the inhalants, have some really serious side effects. There's something called sudden sniffing death syndrome, where there can be fatal cardiac arrhythmias, there can be brain injury, there can be peripheral nerve injury. So the solvent family of medications are typically most commonly abused by the adolescent population. Classic age for first use is around age 14 to 15. Now with drug testing that's been done extensively at so many different places of employment, we're now seeing more adults use these because these drugs are not picked up by routine drug screening. So as concerned family members or parents, it can be difficult to diagnose somebody that may have inhalant abuse. And so what are we looking for? These things can be sudden changes in behavior. You can see somebody that you're talking to them and then a few minutes later they're sound asleep or they're hard to awaken, that you might see, because commonly they're inhaled obviously through the nose as well as the mouth. You might see nosebleeds, you might see psychological changes, paranoia, you might talk about hallucinations. So there's a sort of a broad range of potential symptoms, but the overdose dangers over time is this sort of cumulative injury, cumulative brain injury. The solvent family of drugs, those things can be, sometimes they're used in bags where they might put a bag over their head. That can be a plastic bag, which obviously has dangers of asphyxiation and or death, or a paper bag. They can be put on clothing, on their sleeves, on their collars, where they just kind of keep leaning down and sort of sniffing and inhaling that odor. For that euphoric high. So that's the solvent family of medications. Gases would be the next family of medications. And so the gases, think about propane, butane, the gases that you might think about in a stove or a heating element. But the most common gas that we see from an abuse standpoint is nitrous oxide. So some of you may be familiar with nitrous oxide as laughing gas. Nitrous oxide is also available in these little cartridges that they use for whipped cream dispensers, and they are readily available. They are available in large quantities, commonly known in the colloquial name of whippets, and those drugs can be inhaled directly or commonly put into a balloon and then inhale that gas. So that is actually an anesthetic agent. That anesthetic agent can cause initially a sense of euphoria, but then, like a true anesthetic agent, it can actually cause loss of consciousness. And so you can then have brain injury that occurs from low oxygen levels. Again, you can have significant nerve injury. Some of the worst cases of what are called a peripheral neuropathy, where people lose sensation in their feet and ankles, can affect their gait, their ability to walk and balance. So I've seen some severe peripheral neuropathies from nitrous oxide's potential for severe brain injury. That drug is one of the most common things that we see here in the inhalant class in patients at La Hacienda, and a drug that has incredible danger. So that's in the gas family of medication. There are a group of drugs that are called nitrites. Specifically, they come in a small capsule or glass that can be broken or popped. They're commonly called poppers. Those two drugs primarily that we see are ones called amyl nitrite and butyl nitrite. Those drugs also have some smooth muscle relaxation and can be used in different sort of sexual processes. And those drugs also have significant abuse potential. Those drugs also have potential for low oxygen states and brain injury from being hypoxic, because that drug actually displaces oxygen from cells in the brain from a danger standpoint. The last group of meds that I want to talk about, or chemicals, really would be the aerosols. And the aerosols, the primary one that we see abused these days are the propellant that's in computer duster. Those different propellants can be in hairspray or spray paints, different sprays for cleaning automobile parts. But particularly the one that we see most commonly here is computer duster. Now, the computer duster sprays, that propellant is like a refrigerant. So if you think about adding a refrigerant to your air conditioning system, those refrigerants are propellants. So the most common ones are hydrocarbons, or what are called fluorocarbons. Those chemicals get very, very cold as they come out of the can. So when you think about compressed air, it's not actually just compressed air. So those propellants, the hydrocarbons or fluorocarbons, can be inhaled. We have had several different patients who have unfortunately been treated that did not follow through and relapsed and died with duster use over the past few years. Think specifically of a young man, a brilliant young successful attorney, and with that inhalant use, they very rapidly can lose consciousness, and he was using actually by a river and ended up falling in and drowning in just this catastrophic, incredibly sad case. Those drugs you can see potentially cold burns. So if you have a loved one that might have all of a sudden like a blister on their face or on their neck because those cans get so cold as they activate that and they inhale that chemical. Those chemicals cause a euphoria, but again, shortly after the euphoria can be this actual loss of consciousness, so causing car wrecks or again, profound changes in behavior. Again, none of these detected in routine drug screens. The whole inhalant family of drugs are some of the more frightening drugs that we deal with here because they're cheap, they're not detected on drug screens, they're available at Walmart or any store. Commonly, there's not even sort of age limitations in procuring some of those chemicals that have potential for abuse. So if you have somebody that's struggling with that, certainly somebody that needs help, they have potential fatal complications, we'd love to help you explore different treatment options. Thanks.